or turning off the recording for a portion for the speakers. All microphones are muted when you first arrive. We are aiming to finish by 9:30. It may be a couple minutes after that, depending on questions. And we are, of course, we're all in this together. So just please bear in mind, we're looking to be respectful to each other for our questions and comments. Priority is going to be given to questions that are from our BIA members. And topics outside the BIA mandate may not be able to be addressed. We'll try to provide you some kind of information. Angela and Taylor are going to be monitoring the questions. And I'm going to post into the chat right now. I pasted that right. There we go. Information for doing the questions. So when you have a question, we're asking that it be typed into the chat, as I've just pasted into the chat there. Or you can email questions to admin at Downtown Oshawa, or you can text them into one of these 2 cell numbers that are showing in the chat message window as well. So, with that said, I'm just going to quickly introduce our speakers and turn it right over to them so that you have lots of time to be able to present. Each one's going to have about 5 minutes to speak about their role. And we have John Richer, who's representing EMS services. We have Nancy Wilson from Fire Services. We have Kevin Fegan from Bylaw. And then finally, we have Inspector Saliba and Staff Sergeant Melnick from DRPS. And then what I'd suggest is hear their presentations, sort of put your questions together in mind, and then type them into the chat as these individuals finish up each of their presentations. So with that, I'm going to turn it over to John.
Good morning, everybody. Can you hear me okay? Yep, okay. So my name is John Riches. I'm a Deputy Chief with Paramedic Services here at the Region of Durham. To give you just a quick background on Paramedic Services, everybody, generally speaking, sees and knows what we do because we're in the ambulances driving around the city. But we are a division of the Region of Durham, 50% funded by your regional tax base and 50% funded by the Province of Ontario through the Ministry of Health. Generally speaking, we cover the entire Region of Durham from Pickering all the way over to Newtonville and or that border, and then all the way up to Beaver, the end of the top of Brock Township. We have 31 ambulances at peak time on our day shift and 21 ambulances on our night shift that cover that entire area, with a couple of single person rapid response units interspersed in there. In Oshawa in particular, we have 2 stations, one on Bloor Street in South Oshawa and another on Wilson Road in North Oshawa near North End Bowl. And between those 2 stations, we have 9 ambulances that cover the city of Oshawa on days, and it drops down to 5 at night. Our deployment is based on a call volume model, so the more call volume a certain area has, the more ambulances they have. It's kind of that simple. And at night, we do see a downturn in our call volume, so that's why we don't have as many ambulances overnight as we do during the day. Specifically to Oshawa Downtown, the other program that we run here is called the PCOP program, which some of you in the Oshawa Downtown BIA may have heard of. It's called the Primary Care Outreach Program. It's a joint partnership with our Social Services Department, and that is a single paramedic partnered with a social worker working in an unmarked white Tahoe, servicing the needs of the homeless population in the region. It originally started servicing downtown Oshawa, but recently that program's expanded to cover the entire region as we address the vulnerable populations in the entire region. In terms of messages for the BIA and what we kind of would like you to do in terms of safety from our perspective, some of them are the standards. You know, making sure that in office buildings you have defibrillators and things like that, because when someone has a cardiac arrest, time to a defibrillator and receiving a defibrillation if their heart is stopped is critical, and it's proven medically and through science to work. The other thing is when 911 gets called, making sure we have proper access instructions of how to get to wherever you're calling 911 for, appreciating that Oshawa Downtown is very urban, lots of office buildings, lots of older buildings that have converted to office buildings. So there's a lot of challenges for access in that regard. And myself, I've been in the business 25 years and I spent 16 years as a medic in Oshawa. So I'm intimately familiar with covering Oshawa. And it is a challenge sometimes to find where patients are when 911 is called. So that could be very helpful. The other thing, as everybody can appreciate, downtown Oshawa with one-way streets, is traffic patterns and traffic flow can be a challenge for our ambulances to get to where they need to, especially in an emergency. And in the pandemic, I would be remiss if I didn't comment on the pandemic and everything we're going through. The importance of obviously wearing a mask indoors, following those rules, washing your hands, and making sure you give us the time and space we need to work. And then I guess I'm going to indulge and ask for patience. Our paramedics are required by legislation when they arrive on scene to put on a full set of personal protective equipment due to the pandemic. So sometimes we're dealing with issues where the public thinks we're not rushing, we're not showing up in time. And really what's happened is we might take 3 minutes to drive to a scene, but then it takes the paramedics 4 or 5 minutes to put all their personal protective gear on. And they're required to do that because they need to be safe. So I guess we're asking for your patience as well in that regard. And then the other thing we're currently working on, although it's not implemented, is we're looking on how do we support our non-911 response, so our community level response to deal with things like mental health, addictions, people at home and people in their homes who are socially isolated and things like that. And that's, you know, as everybody's probably paid attention to everything the Premier has said in the news and stuff like that, that's front of mind for everybody, especially in the pandemic, because we are seeing an increase in mental health responses as a result of people being very stressed. So that's a really quick, hopefully less than 5 minute talk about what paramedic services does. The last thing I will say is we are staffed with advanced care paramedics and primary care paramedics. So the best way I can explain to you what we do is we bring the emergency department to you when you're in a medical need, and we can provide the first hour of care that any emergency department, generally speaking, can provide. And if patients are critically ill, then the response is to kind of, we call it load and go, get them in the ambulance, treat while we're transporting. So that's my little spiel about paramedic services. Thank you for having me this morning.
Thank you very much, John. That was excellent. So again, if you have any questions, please feel free to post them into the chat here, or to text them to one of the 2 numbers that Angela has posted there. And then I'm going to pass it over to Nancy Wilson from Fire Services.
Great. Thank you very much, Paul, for having us here today. At Oshawa Fire Services, basically things are business as usual here. As John was saying, certainly there's a lot of safety precautions and different things that are happening with all emergency responses, but we're still going to all the same places. We're still doing all the same things. Our focus is always prevention, detection, escape, thinking of all those 3 things before the fire suppression crews have to get there. I mean, obviously in emergency situations, it's different. I'm sorry, we are a working fire hall and the tones are going off in the background right now. So, you know, basically what we want people to think about is it's also somewhat business as usual for you in regard to fire and life safety systems. We want to make sure that the business owners, the owners, the renters all have a good understanding of different responsibilities for the fire and life safety systems in their buildings. So we're talking about fire alarm systems, sprinkler systems, standpipes, hose cabinets, extinguishers, emergency lighting, pardon me, and then also kitchen suppression systems. So all of those things need to be maintained. You know, there are still companies out there that are doing this. They're, you know, doing it in safe ways. You know, they're you know, masking up. They have protection things that they're doing so that they can come in and do these things and make sure that it's safe for the residents, and also, you know, hopefully preventing fires and emergencies from happening. The other thing we want to have people remember is their fire safety plans. Certain buildings are required to have fire safety plans, and these are great tools for people to use. It gives you all the information on fire safety. It talks about owners' responsibilities. It talks about the tenants' responsibilities. It talks about how many times you have to have your fire alarm system checked, what you're expected to do on a monthly basis, or what you have to have other people come in and do. The other thing it talks about is what to do in the event of a fire, how to get out, and it also has great little schematics so that if the firefighters are showing up there, they've never been into that building, they can look at it and they know where to find everything. So basically, not much changes in those fire safety plans on a yearly basis. However, there is always emergency contacts, and that's really important that people keep up to date. That way, we have an alarm activation at 2 o'clock in the morning and we need to turn that building over to somebody. We know how to get hold of the people. So want to make sure that the tenant information is up to date, the owner information is up to date, and how we are contacting those people so that we can get hold of them. It's a really important part of the whole, preparation for fire safety. Obviously, there have been a lot of changes, with COVID and different things and protocols, and we're still going out, we're still, doing inspections, we're still, trying to get into places and make sure that they're safe, but, we want to make sure that, that the owners and the business owners are doing the same thing. If you have any questions, you can always contact your fire department. We are here, we're working. You can contact us at 905-436-3311, and we'll be there to answer any questions or concerns that you do have. Obviously, if you have any questions, you can add those to the chat and we can discuss those later. I would be remiss if I didn't talk about also fire safety at home. That is our biggest fire safety concern. It's the leading cause of fires, and fire deaths are in homes. So, as I have the opportunity to talk to people, I also want to remind you to make sure that your smoke alarms are working. Make sure your family has a plan on what you need to do. Test your smoke alarms monthly. We have a big campaign right now. We just finished with Fire Prevention Week. It looked a lot different than it has in the years past. But also coming up in the next couple weeks, it's going to be the, change your clocks and check your smoke alarms at that time. So smoke alarms should be checked monthly. They also only have a 10-year life expectancy, so you need to change those after 10 years, whether they're battery or electric type smoke alarms. They do need to be changed. And make sure that your family knows exactly what they're going to do in the event of a fire, and you have a safe meeting place for everybody to meet out front of your residence, so that way the firefighters can see you when they show up. And we just want everybody to be safe at home and at work. Also, I did want to talk about for the business owners as well, just making sure that your exits, your rear exits, is usually what we find more of a concern, that they're accessible, not blocked, and then also once you get outside too, so there's not storage and things in the back that would block people from getting out that way. Anyway, thank you very much for having me as well. I appreciate it, and if you do have any fire safety questions, I'll be glad to answer them. Thank you.
That's great. Thank you very much, Nancy. Much appreciated. Andrew, I just wanted to comment. I do apologize. We did remotely turn off your camera because we saw that you're out and about in your task there this morning. We didn't want to bring the public in, or like the clients that you're working with, into the view there. So we did have to turn that off. I'm sorry. But we just wanted to make sure that we weren't bringing people in who weren't aware that this was all being recorded as well. So. Question actually just quickly though for either yourself or John there, Nancy, first aid kits and public response. Any thoughts, recommendations on things that people may find most useful to have in their first aid kits based on your experience in the downtown, that kind of stuff?
I can take this one if that's okay, Nancy.
No, go ahead.
Our perspective on that, the most important things are honestly personal protective equipment in this day and age. Making sure there's gloves so you can help somebody who might be bleeding or have other bodily fluids, and then you don't have to worry about yourself potentially being, contaminated or contracting something. But very important, and it's across all populations. It doesn't matter if it's downtown Oshawa, we'd recommend that anywhere. The other piece would be if you had to do rescue breathing for somebody who was not breathing, a pocket mask. They're common in most first aid kits. And that, again, will allow you to do mouth-to-mouth breathing, as it's traditionally called in the old days, so to speak. And again, not have to touch skin to skin, and it provides you a protective barrier. And then the final thing is what I said at the beginning. Although it's not legislated as part of a first aid kit, we would highly recommend that public access defibrillators, and I know many of the buildings downtown already have them, but we would highly recommend those, especially in areas that we are what I would call our high traffic areas. Some of the downtown banking buildings have them already. The more people you have coming in and out of your building, the more you need a defibrillator is kind of really our approach to that. And then certainly things to help with bleed control and stuff like that. And then finally, the real thing, and I didn't mention this, so I appreciate the question. Another thing that's really important is getting the information we need for that person you've called 911 about. It is a huge important part in the continuum of care for people who need medical care, especially when they're unresponsive and are unable to speak for themselves. So being able to get, find their health card, find their driver's license, so that when we show up, you can just hand it to us, that kind of idea. Or if somebody has a medical alert, advising us of that. So that's kind of a general approach to those things. Thanks for the question, though.
Great, excellent, thank you. Okay, I'm going to turn it over now to Kevin Fegan from Bylaw.
Okay, thank you for the opportunity to provide an overview of municipal law enforcement and what we're responsible for in relation to safety and security. I think at times there can be confusion as to what our group does and what bylaws we enforce and the process for reporting these issues. So I hope to shed some light on that today. Municipal law enforcement handles bylaw issues from A to Z, involving animals all the way through to zoning. And there are approximately 34 bylaws that we enforce, and MLE's effect on the broader community contributes to improved quality of life, improved health and safety, and increased consumer protection. Our enforcement approach is compliance-focused and risk-based, results in response to bylaw concerns being both reactive, responding to complaints in that case, and proactive, such as projects or initiatives based on risk or need. Compliance is achieved generally through education, warnings, and administrative processes, things like notices of violation, orders, penalties or tickets, charges, and ultimately prosecution if necessary. In relation to safety and security in our downtown, our operations can be broken into 4 main categories. First being property enforcement. City Council passes property-related bylaws on safety, maintenance, beautification, livability, and sustainability to establish standards for all property owners to follow. It includes bylaws such as the Property Standards Bylaw, ensuring that properties meet the minimum prescribed standard of maintenance and repair. This can be critical to both safety and security, ranging from a building with missing screens on an upper story window, derelict structures which invite unlawful behavior and vagrancy. Property enforcement also includes regulations passed such as adequate heat bylaw, which requires rented or leased living accommodations to have a minimum air temperature between the months of September and June of each year. It includes bylaws to address boulevard maintenance, such as long grass and weeds, lot maintenance, keeping properties free of waste or refuse and debris that invite vermin or waste in the form of needles and broken glass. We also respond to noise that disturbs inhabitants of the city of Oshawa, and again, this can range from the noise of amplified music to construction noise. We enforce the setting out of waste, ensuring that it's only put out at the correct set out times, and then appropriate containers, which reduces noxious odors, scavenging by wildlife, and safety for pedestrians using the sidewalks. We enforce the nuisance bylaw and activities such as aggressive soliciting, loitering on public property and private property that's in public view, unlawful drinking, fighting, and similar behaviors. We often deal with concerns expressed involving bicycles, e-bikes, and skateboards that are being driven on our sidewalks. And these are regulated to ensure both pedestrian and traffic safety. Property enforcement is certainly a large part of our work and contributes to both safety and security in our community and overall aesthetics of our downtown. In doing these functions, we also provide support and assistance to many external agencies, including Durham Regional Police Service and the Durham Region Health Department. We typically participate in several joint projects each year, working closely with our community partners to ensure that efficient and effective use of our resources. The second category is parking enforcement. MLE monitors, regulates, and enforces parking regulations on city streets in order to meet the needs of residents, businesses, and visitors. We ensure that traffic is able to flow effectively and safely by enforcing parking restrictions, time parking limits on street and surface lots, no stopping or no parking areas, adjacent to intersections, at bus stops, taxi stands, as well as accessible parking spaces, ensuring that they're provided and maintained for permit holders and that fire routes remain open and safe for emergency services. Our officers are also very active at special events such as Cars on King and Bikes on Bond. The third category is animal enforcement. We respond to reports of vicious animals, dog bites, animals running at large, diseased or injured animals, and dead stock on city streets and public property. We ensure that the public's interactions with animals, both wild and domestic, have safety at the forefront and limiting motor vehicle accidents, ensuring safe and sanitary conditions on our streets. Lastly is our corporate security. Our corporate security team provides security at over 30 city facilities and parks, including in the downtown core. The parkades at Garage 1, 2, and 3, Memorial Park, and they also provide dispatch and advice on a variety of after-hours calls in relation to things like road or street damage, lights that are out, stop signs that are down, and so on. So those are the primary categories which complement safety and security in our downtown. Concerns or complaints can be made by contacting Service Oshawa. You can reach us by phone, in person at City Hall. Live chat is also available, email and online service requests. I'm also happy to hear from business owners and residents and to meet to review any concerns that they might have in relation to our services. Thanks.
Okay, that's great. Thank you, Kevin. So Kevin, just to clarify, when you say chat, so if they just go to oshawa.ca, there's a chat window that they can open there to get the Service Oshawa?
Yes, there is.
Okay.
Good morning. Sorry, I have a question for Kevin.
Sure.
Good morning, Kevin. It's Gino Nastamate. Question I have is the response time when a complaint does come in.
It can depend in each circumstance, again, depending on where the officers might be in proximity to that location, or what calls they may be receiving that day. What I do find typically in most circumstances, they're there in 20 minutes or less, but again, that can vary from the day.
Okay, and is there a program that would allow landlords, property owners to actually issue tickets? Maybe, parking or infractions or loitering. And the reason I ask that is, Kevin, the reason I ask that is because there's a few instances where, like I said, the response time may be inadequate at that time, and the offense has already occurred.
Yeah, we do have a program for private property parking enforcement, and that involves situations where we've already done site approvals, that we've ensured that all the appropriate signage is in place. The contracting then by the private property owner with a security guard company, and a guard then that has been given formal training with regards to our procedures and the issuance of administrative monetary penalties related to private parking. They can also do fire route, accessible parking spaces as well. That's the only program that basically entails having a private property owner being able to enforce parking restrictions on their sites. Anything other than that, of course, they do have to be a municipal law enforcement officer, and it's simply addressed through our group.
And where would I be able to find this program and apply?
You can just contact us directly through Service Oshawa or our direct line to our bylaw administration, and we can provide you with the documentation in terms of starting that program.
Thank you.
I believe that was Gino again. Thank you, Gino. Just the format I've been asked for, folks, is if you don't mind, if as much as possible, to put questions into the chat. I know you were on the phone there, Gino. So thank you for your questions. Appreciate it. And thank you, Kevin, for being able to dive in onto those. I do have a couple of others here. I think one is really going to be for DRPS, and they haven't spoken just yet, but I'll just note it off here just for some forethought. With the growing number of homeless people we're experiencing, this is from the Carriage House. Thank you, Sandra. We're experiencing a large number of homeless people attempting to get into our building, and actually we've had 3 or 4 people that did get into our building. So when should we be calling the police, especially in the middle of the night? So I'll say that for DRPS, which we're going to speak in a moment. We have Daryl Sherman asking, there's about 25 agencies in downtown Oshawa providing different services to those in need. How does your organization coordinate handing off the situations to appropriate agencies, and how do you suggest your organization be better communicate to the downtown community, which is increasingly inclusive of residents? So Daryl, can you just clarify who you're asking that question to? I'm not quite sure who you're directing that one at.
Good morning. I think we could start with the Durham Police, but truthfully, I would like to know that we just heard initially from ambulance that there's plans to if there's a situation they will do a handoff. I assume a lot of it would be to the hospital, but when there's a situation where it may be appropriate to have one of the agencies that are working in the downtown, I'm just curious to know how they calculate or figure out which one they would hand off to. So I think police and ambulance would be the first two that I'd be interested in hearing from.
Okay, so why don't we actually first just touch back with John, because he was our first speaker, and he can speak to the EMS side of that. John?
Sure, and thank you for your question, Daryl, and fully being transparent. This is a warm handoff is an ongoing, what we call in the business a warm handoff is an ongoing challenge. It's not a challenge when we transport somebody to the hospital, because you're right, Daryl, in those cases we are handing over care to the emergency department, and then from that point on, there's hope that through the Central East Lynn or other agencies through the emerge department, that they do a warm handoff to another agency within the community if someone needs support. Where we find the challenge is with those 911 calls we do, and the person we call 911 or we're called for refuses our help, refuses our service, walks away, and that happens unfortunately fairly regularly. However, that's one of the reasons why we have that PCOP program in there with that paramedic and social worker. They're not part of the 911 system. Their goal is community outreach, is to establish links with community agencies, Cornerstone, the Backdoor Mission, other areas working downtown. And the social worker's name is Kelly. The paramedic's name is Frank. They're dedicated to this full time every week. And so that is happening on an ongoing basis. The other answer, the other part to your question that's really important is this idea of proper access and navigation when somebody needs help beyond the 911 call. And that's an ongoing challenge that everybody's experiencing, both in the acute care sector and in the community response sector, as you've identified, Daryl. So it is a challenge. It is something we're trying to address by having non-911 response resources. So paramedics who can work as what we would call community paramedics, that can go out into the community, do outreach, kind of connect with people, try and do warm handoff. Some other areas call it social navigation, where we help someone get access to housing, things like that. So, and that is happening. and it may not be as open and as transparent as people may like, but it is something we're currently working on and trying to address. Thank you for your question.
Great, thank you, John. And then we'll sort of blend right into Inspector Saliba and Staff Sergeant Melnick from DRPS to sort of give their presentation, and then if you guys don't mind, then tackling that question as well within there. Thank you.
Good morning, and thank you for having us today. So my name is Inspector Dave Saliba, as Paul mentioned, and I'm here today with Staff Sergeant Tom Melnick. We form the leadership for Central East Division. And my hope here today is to provide some information related to the downtown and some of the strategies that we're using to tackle some of the issues within the downtown. So the first thing I want to talk about is our calls for service. So we keep a very close eye on our calls for service in relation to the downtown. And this is done through monitoring from our crime analyst. And we completely understand the struggles that are affecting the businesses within the downtown. But I want to provide an overall understanding of our calls for service as they relate to our downtown. When we receive a call for service, we classify them into one of two areas. One being a crime-related call, the other being a disorder-related call. Crime-related calls for service are just kind of what you would expect, which are thefts, assaults, break-ins, that type of issue. Disorder, on the other hand, are calls for service that are related to disputes, disturbances, unwanted persons. Now, keeping those two categories in mind, our statistics related to crime-related calls for service from 2015 to 2020 are down overall by 19%. In the last 3 years, our crime-related calls for service are down 10.5%. And by comparison, year to date, 2019 to 2020, we're down just over 19%. Disorder-related calls for service, however, are up from 2015 to 2020, and they're up by approximately 12%. In the last 3 years, they have increased by just over 7%. And our greatest increase in calls for service since the start of the pandemic during the months of March, July, and August, and they were related to disturbances, suspicious persons, and unwanted persons. And these are the types of calls for service that I think are most affecting our downtown businesses. Other disorder-related calls that would also be included would be anything in relation to drugs, fights, mental health act, to noise, just to name a few. As far as our strategies go, from 2017, Oshawa saw its highest statistics in relation to crime and disorder offenses within the downtown. When I arrived here in 2018, both Staff Sergeant Melnick and I saw a need to address issues within the downtown. So we consulted with the BIA. Garth Johns was instrumental in that. Oshawa Council, we also spoke with, and specifically with Mayor Henry. And as a result, we created a full-time foot patrol presence within the downtown. We placed 2 veteran officers as a visible presence in our downtown core. And they were conducting daily foot patrols in areas of identified concern in an effort to improve the general feeling of safety and well-being. The foot patrols were proactive in nature rather than our traditional methods of reactive policing models. And we also commenced weekly meetings with our crime analysts to ensure a fulsome understanding of crime and disorder within our downtown. Provincial funding was also utilized in the form of anti-violence intervention strategies. And the Durham Region Anti-Violence Intervention Strategy was utilized, totaling 1,200 hours of proactive engagement. And that was in addition to our full-time foot patrol presence. In 2019, the provincial funding was no longer available. So we were forced to look at other alternatives. And as a result, we initiated our downtown project, which saw an additional 675 hours of proactive police response. And once again, this was in addition to our foot patrol program. In this past year, in 2020, it has been a bit of a challenge in dealing with the pandemic, and we reassigned additional resources to augment our foot and bicycle patrols. We had an additional 5 officers assigned to the downtown, in addition to our 2 full-time foot patrol officers. And we've been running another downtown project just recently since the start of September. And that's, we've put in an additional 1,000 hours of proactive patrol hours, resulting in 45 arrests, 207 provincial offense notices being issued, as well as 15 Part 3 offense notices. And the good news story from my perspective is that my officers have not lost sight of the human element when dealing with people. And I've received numerous reports of persons who are under the influence of drugs or alcohol and a potential risk to themselves. And on one occasion during a property check, my officers located a person that had overdosed and was vital signs absent. The officers performed CPR for an extended period of time until EMS arrived. When EMS arrived, we were able to hand that person off and thankfully save that person's life. On another occurrence with our project, one of my officers that was involved in the project saw a male that was looking at an e-bike at the Midtown Mall, was able to approach the male, saw that the male indicated that the bike was his, and he'd lost his keys. As a result of that interaction with the individual, the true owner of the e-bike showed up several minutes later, so we were able to prevent offenses from occurring. And on another occasion, during a property check, officers located a subject sitting in the rear steps of a community center. The individual was very unkempt and appeared to be homeless. And when speaking with the individual, they identified that they resided with a family. However, they stated that the information that we received was not consistent with someone who would have a residence, that have access to water or hygiene products. And the officers completed an investigation. After speaking with possible neighbors, a report was filed and a referral was made to Durham Connect, as well as our own mental health unit, in hopes that assistance could be provided in a different venue. And I think that kind of addresses some of the questions that Daniel had. Our community response team is also a vital part of the strategies that we utilize. Now, for those that don't know, my community response team is an all-closed unit. So when they are out and about, you're not going to recognize them as police officers. And they've been working actively to address those that are dealing drugs throughout Oshawa, and specifically within the downtown core. And as a matter of fact, just last evening, a significant arrest was made within the downtown by my community response team. We also meet regularly with the mayor's office in an effort to address areas of concern. And we meet with them, with the mayor monthly, and we have regular communication, which is done basically weekly. Since 2018, we've devoted in excess of 10,000 hours of proactive police response. Now, I want people to understand that proactive time is not a typical response. Reactive policing is what we're used to seeing. And our reactive policing hours would also be in the thousands of hours if we were to calculate that in, but it's from a proactive standpoint in the last 3 years, it's been in excess of 10,000 hours. Offenders, we do have some prolific offenders within our downtown. Recidivism is a significant challenge for my officers. I could go into detail about that, but suffice to say that there are areas that would best be served by dealing with some of these individuals in different venues. Some of the challenges that we have are that, and I want to provide an understanding of what our limitations are. We can only work within the framework that we're provided. And there is some sentiment that we should be able to arrest and charge our way out of community problems, and it's not realistic. Our provincial legislation and our local bylaws, and Kevin can speak to this as well, they're rarely a deterrent for some of the unsheltered. because the risk of fines and license registration suspensions are not effective, as most of those people are not driving. So the lack of enforcement options kind of limits our ability to influence behavior for our offenders within the downtown. The challenge that we have is sustaining these proactive enforcement efforts with all the other important demands for our time. Roadway safety being very high up there in our list of demands. We're engaged in over a dozen community partnerships to address the issues within Oshawa. And our officers in Central East Division are out there every single day, every single night, trying to help out and trying to make a difference in the community. And I'm very, very proud of their efforts. And I appreciate the great work they're doing on a daily basis. Homelessness, substance addiction, mental health issues are largely a social issue and are best dealt with utilizing community resources and support agencies rather than from a police enforcement capacity. We do own a piece of that. And what I mean by that is that there are areas of criminality that obviously we have to address. Next steps for us, policing wise, we are 100% committed to providing policing support and enforcement activities where individuals are involved in committing offenses within the region as well as within our downtown core. We're going to continue to provide a visible presence and timely response to offenses and work with our community to ensure a safe and secure environment. We're going to continue to work closely with our community partners in an effort to be a part of the long-lasting and sustainable solution to homelessness in our downtown. We speak regularly with other police services to see what their response techniques are. Just a couple of weeks ago, I was speaking with the superintendent in charge of the Brampton downtown and Peel region. We're always welcome to any suggestions, and we consider recommendations that are made in an effort to address issues of community safety. One of the things that I always ask people to consider when you're considering community safety specific to your own properties is we always appreciate cameras because any video assistance that we can have with criminal investigations is of great benefit for us. Another area that is of great benefit for us is lighting. Lighting tends to deter a lot of criminal behavior because people don't want to be seen. And then one last parting thought that I have is please don't assume that we know. Whenever you have a question, whenever you have a concern, please don't think you're annoying us or taking up our time. We want you to call. We want you to tell us whatever that information is, and we want to know exactly what you're dealing with and what your challenges are. And with regards to Sharon, when to call the police, Sharon, anytime you are having challenges in relation to people that are hanging around your business and you're concerned about safety, please give us a call. Again, you're not wasting our time. We need to be aware of it because again, the only way we can assign our resources accordingly is to be 100% aware of what is going on. We also have a community safety advisory committee that we've established within this division, and the intention of the Community Safety Advisory Committee is to provide us with some enhanced understanding of what is going on with the community, because again, we don't know everything, and we need that input from our community members to help us to know where we are going to assign resources and make sure we are addressing the need at the time.
Great.
And hopefully that's basically about all that I can say at this point, Paul.
Thank you, David. Much appreciated. And thank you for taking on that question. There's a few more that have come in. So we may need to run a few minutes beyond 9:30. I apologize, but we want to make sure we try to get everybody's questions in there for you guys to be able to take on. I do understand that other people may have some other Zoom meetings right on top of this. Let's see how well we can do here. We have a question from Colin, our MP, Dr. Colin Carey, and I'm sure you yourself get many calls Dr. Carey, and Rick Kerr too, I'm sure gets plenty of calls from the community from people looking for help with things. So his question was, and it's for John, can you comment on the potential role of community paramedicine and the potential benefits of proactive measures on the ground, especially with regards to the homeless and addictions issues? Are there pilot projects that on the go? Is that the role of Kelly and Frank?
That is, they're the tip of the spear on that, if you'll allow for the vernacular. But one of the things we are working on in the region is expanding the PCOP program to be beyond just one team, adding maybe 2 or 3 teams. We are finding a great deal of success on the navigation piece, because our experience with some of the vulnerable population is connecting them to services is one of the most important measures to get them to that next step where they're not as high needs or needing 911. The province has recently announced that they hope to expand funding for community paramedicine across the province, and certainly here at the Region of Durham, we're anxious and hopeful to receive some of that funding. We do have kind of business case plans ready to go to expand to community paramedicine. And as everybody can appreciate, funding is a huge component of that. It does cost money. But I would like to just add to something that Inspector Saliba said. That's called, proactive response, and paramedicine by nature traditionally has been a reactive through 911 service, and it's in our best interest, as is everybody in the Oshawa Downtown BIA, that if we can get into more proactive type community responses, that will reduce the pressure on the 911 system. It is proven internationally that if you can get to somebody and provide them access to service before they need to call 911, they're less likely to continue to call 911 on an ongoing basis, which creates pressures on our system. So it's certainly something we want to do. And once the funding comes, you'll see an expansion. And it is something we're constantly advocating to regional council to fund as well. Thank you.
Thank you, John. And then we have a question from John Daniel, and I believe this is for yourself, David. Can you provide? I think you touched on this right in the beginning of your comments, sir. Can you provide specific information about the pre-pandemic crime rates in Oshawa, as well as individual Oshawa neighborhoods, such as the downtown core, how they compare to other cities and other neighborhoods, respectively? There's a crime mapping service, but it's apparently incomplete, and the terms for use forbid mapping the addresses included.
So thank you very much for the question. Our crime rates have been, I haven't seen a significant impact during the pandemic itself. We have seen, because I can't really equate our numbers to the pandemic without any evidence to address that. We can look at our crime rates from the start of March till current, and we have done that, and we have seen a reduction in our crime rates, but we can't really equate it to the pandemic itself. We have seen our disorder-related calls have gone up during that same time period. So from March until September, our information that we have been provided from our crime analyst would suggest crime is down during that period of time. However, disorder-related calls for service are up. Is there anything specific in terms of the pandemic that has caused that? That I can't comment on.
Okay. Just as an aside, so at John Hart Society, we run some diversion programs as well, youth diversion and adult diversion services. And I can tell you that from our side, since the pandemic, we've also seen a decrease in the number of cases that our staff carry in those 2 programs as well. But can we say specifically it's because of the pandemic? That, it's probably largely influenced by it, but there may be other factors there as well. So we have another question here. This is from MP Dr. Colin Carey. It's, can you comment on the issue of human trafficking in Oshawa and the challenges that arise from human trafficking? Are we seeing an increase during the pandemic and the crime associated with human trafficking?
Thank you, Dr. Carey, for the question. We are typically challenged with human trafficking, but that is holistic across the region itself. It's not specific to one area. We do see incidents of human trafficking that follow the 401 corridor. And our human trafficking unit has done a phenomenal job of addressing areas of concern of human trafficking. And that is across the region. And we are linked in with all the other police services to ensure that we are addressing it provincially, to be quite honest with you. As far as an increase during the pandemic, I can't really speak to that because the human trafficking unit works under the major crime umbrella. So I can't really speak with any specifics related to the pandemic. So my apologies for that. But if you like, I'd be happy to get that information and get it back to you.
Great, thank you. Got another one for you. Sorry, this is all landing on your shoulders. David, can you speak to when it's appropriate to call 911? Anecdotally, last week, we witnessed an individual in distress at the corner across from our store, Gerald Sherman's store. Our staff wanted to call for assistance. And we had a number for Welcoming Streets, but when we called, they were not attending. So this follows my question on communication and confusion over the multitude of services. That's the question re 911. You can also, for folks who are, if there's more questions coming that we don't get to today, we just want to let you know too that you can also shoot the question to admin at Downtown Oshawa.ca at any time if we don't get through all these questions today.
Daryl, very, very good question, and thank you for that. One of our priorities is always life, and anytime that a life is in jeopardy, it's always appropriate to call 911, especially when you're recognizing that somebody is potentially overdosing in some type of medical distress. Both myself and John, we're going to want our people to be aware of it. We do have, like I said earlier, we do have our foot patrol program working every single day. We have our downtown project, which is working every single day. And that is in addition to our reactive response to calls for service. So we would absolutely want to be called for something where you're seeing somebody who's in a medical distress and in need of intervention. Because again, that's one of our priorities, and I'm sure John can comment on that as well, that he would also want that type of information so that they are responding appropriately.
I'll just add in there, thanks, David. Totally agree. If you see somebody in medical distress, we'd rather you call 911, we show up, and it end up being, a good outcome in terms of a false alarm than, waiting, not sure if you should call, and then by the time we get there, whatever is going on with them is, has caused them to become critically ill or, heaven forbid, perish. So, especially with the ongoing struggles the entire community is facing with regards to, the opioid epidemic and things like that, that time for us to get there is critical. Our response time is really important in those scenarios, to give Narcan, to provide breathing support. And we would rather do that than get there and now the patient's heart has already stopped and now we're fighting the clock even more. So totally recommend, thank you, Dave, and also Daryl for the question. Totally recommend you just call and we'll sort it out from there. Thank you.
Thank you, John. I just wanted to note too that as Peter Stowett has posted in here, they are working on the human trafficking COVID link at Ontario Tech right now as well. From Oshawa City Council, Rick Kerr, if you can unmute yourself, Angela was saying that you had something that you want to ask.
Can you hear me okay now?
Yeah, that's great.
All right, thanks. Sometimes this system quietly mutes you with a *6, and you unmute your phone, and then you realize that they still can't hear me. So just a general question for the DRPS this morning. Over the summer months, the city contracted CDN protection to provide additional security downtown. This was intended to service on 3 levels. One was the hands-off, but the reporting of any criminal activity to DRPS. Hands-on in the administration of naloxone in an opioid overdose case, and hands-on in the sense of directing people in need to the various services that we have in the downtown in terms of, perhaps Mission United with mental health counseling, addiction counseling, and so forth. So I just wonder, I don't believe you're able to comment on the direction of those in need to services. I'm not sure you're able to comment on whether you, DRPS, witnessed any naloxone administration from CDN security, but I'm just curious as to the relationship between CDN potentially reporting criminal activity and what that type of activity was and what kind of response was able to be delivered in that regard.
Morning, Councillor Kerr. To be honest, we don't have that information. We wouldn't be tracking that. I'm sure it is something that we could potentially pull that information out of our databases, but we don't have that information at this time. I'm sorry.
Okay, well, that's no worry. I thought maybe it was drilling into the weeds a bit because you'd have to be going looking through a call volume and so forth. But I know there was some desire to see some statistics on the impact of this increased security presence downtown, and I just wondered whether that information had been either collected or asked for. So thanks. At this point, I understand why you might not have that at your fingertips, and in fact you don't. But that's fine. Thank you. I appreciate the response. Thanks, Paul. I think that pretty much clears up my questions. Thank you.
Thank you, Rick. And Andrew Clark is on the call here. Thank you for being able to join us, Andrew. He's just written 11 overdose rescues by CDN protection during their contract time. Andrew, did you want to comment just briefly on some of that experience, since the question was kind of around your connection with DRPS and how you guys have connected with DRPS during that time? Don't know if you can unmute yourself there. There we go.
Hey there. Hey, you can hear me. So all of our incidents were reported directly or to the city. That was who we were reporting to. But obviously, any cases of overdose or any medical incidents or criminal, so indictable offenses, we had to contact the police. So we had several incidents. There was a knife incident where the guards helped take a knife off an individual who was threatening another woman with it. There was an incident, an individual broke a bus station glass, and that individual was arrested. There was a fight that broke up where the individuals were arrested for assault and turned over to the police. So there was a lot of interaction. I mean, we interact with the police on a regular basis, but the reporting is to the city, and all the details, all the numbers for everything that was conducted during that contract would be kept in Fagan's realm and not the police's.
Great. Thank you, Andrew. Appreciate that. I know we kind of put you on the spot to try and answer that one, but thank you for that time. We have a question from Sandra Barron. I think this is the DRPS about, are staff allowed to detain a person who's entered the building unlawfully or on the property? And if it got physical, would staff be in trouble for protecting residents till the police get there?
Hi, Sandra. Thanks for the question. It is a very good question, actually. I always caution people in terms of getting into an altercation with anyone. The risk versus the reward portion of it is something that always needs to be explored. And specifically with your staff, it would be challenging if they got into a physical confrontation with someone. Is there legislation protecting those? Yes. there is. However, when I look at a risk versus reward scenario, the risk kind of outweighs the reward in terms of getting into that physical confrontation with somebody. My suggestion would always be have that, try to establish a dialogue with an individual, try to reason with the individual, while at the same time ensuring that you've called 911, stay on the line with our 911 operators, provide as much information as the police are responding to the 911 operators, so that my officers get as much information as they possibly can. The good thing is, from where you are located, because the amount of resources that we have within the downtown, our response time would be very quick. And I think during that time, you might be able to de-escalate through communication and not get into a physical confrontation. I hope that answers your question.
Great, thank you. And John, you had your hand up, sorry.
Sorry, I probably forgot to take it down.
Okay, that's great. And there is, sorry, one other question. Does the fire station at Children's Arena have an active fire truck right now? Probably a question for Nancy there. Are you still with us, Nancy?
Yes, I'm still here.
All right.
Yes, the fire station at Arena has a working fire truck, yes.
Thank you. Okay, so we're a few minutes past 9:30. I apologize that we may be running late. I know, for example, like Councillor Kerr and MP Colin Carey might have some other meetings right on top. So we do appreciate all of you joining us today. I hope that this has been able to enlighten you about some options and resources there. We appreciate the questions that have come in. Coming into our next weekend, I hope last weekend was very rejuvenating for all of you, and that this weekend coming is more time off, because sometimes the long weekend can actually be busier than your regular weekends. If you do have more questions, again, you can email admin@downtownoshawa.ca at any time, and Angela and Taylor will do their best to get those answers for you. In my role at John Howard Society, I'm happy to take questions as well. It's my first and last name, paul.dobbs@jhsd.ca. For our role within the community, we do a lot of housing, employment, counseling programs, adult literacy. Angela, for example, just recently reached out to me about a couple of individuals in the downtown that there's been some concerns with, and I've in turn connected with Bruce McDonald at Lakeridge Health Oshawa about how we could maybe work together to provide some support there. But thank you very much for everybody coming in this morning. Thank you very much for our presenters for your time to take all those questions and give us a summary of your actions there. We really appreciate it, and we hope that you have a great day going forward. So,
Thank you.
Sorry, I should just add that. So again, this meeting was recorded. A summary is going to be put online. It'll be available on, through the downtownoshawa.ca website no later than probably about 4 or 5 days from now. Angela's notes say September 23rd, but that's probably our last meeting. So probably more like by middle of the week next week that this will be posted up. So thanks again, everybody. Have a great morning, great afternoon, and
Thank you.
enjoy your day.
Thanks for having us.
Thanks for having us.
Thank you.